You're watching My Cayman Life TV, and we are at the 11th Annual Cayman Heart Fund International Symposium, bringing together heart specialists from the United States to share with some of our medical professionals here some of the latest advances. I'm talking to Dr. Zeeshan. He is a cardiac surgeon with Cleveland Clinic, and your topic today is current management of thoracic aortic aneurysms. Now, I know you're going to be talking to people in the medical profession about it, and we're kind of talking to the general public, but can you explain what that is? And I think a lot of times when we talk about aneurysms, people think of brain aneurysm, but we're talking chest now.
So thank you, Vanessa, and thank you for having me. So aneurysm as a term is the dilatation of any blood vessel or enlargement of a blood vessel. Today, what I'm talking about is the aneurysms in the chest of the aorta. That is the largest blood vessel in the body. It arises from the heart and then travels in the chest upwards and then downwards and then goes into the abdominal and becomes the abdominal aorta. So we are talking about the dilatation of the thoracic thoracic aorta or the aorta in the chest. And
so important.
Very important. Right. It's very, very important.
Yeah.
So it's a silent killer. It's usually people have no symptoms till it's very large and then it ruptures, but that's what we call aortic dissection or the rupture of the aneurysms. So a lot of people even do not make it to the hospital. So people who know that they have aortic aneurysm, they should be very careful and they should see an aortic specialist to be treated carefully and monitored carefully if their aneurysm is not large.
Okay, so how do they catch this? How do they catch this before it becomes a disaster?
So there are two ways. Usually it is an incidental finding. That means that they go to the hospital for another reason and they have a chest x-ray or a CT scan of the chest or an ultrasound or magnetic resonance imaging or MRI for another reason, and then it is discovered. If it's discovered at that stage, it's usually smaller than the need for an immediate operation.
Okay.
The other way it is discovered is with severe chest pain or back pain, and at that time usually it's either very, very large or it is dissecting. That means it's rupturing or in the process of rupturing, and then the patient needs an operation, usually in an emergency.
How does it present? I mean, is it chest pains that they feel, or how if something's going haywire?
So there are two modes of presentation. One, as I mentioned, is severe chest pain in the mid chest or in the mid back or back of the chest or low or mid back. And that's an emergency. That is one of the most severe pains that one has ever experienced. So that is something that will bring the patient to the emergency room right away. And if they are lucky, they make it in time, and then we treat it as surgeons. The other is the dull ache that is not always there, but it is not associated with exertion or posture. It's usually there. And it's not always aneurysm. A lot of aneurysms are just asymptomatic. So we just have to have the routine testing, and once we discover, then we have to have a very strict surveillance protocol.
Okay. So you don't necessarily have to intervene straight away when it's found. What are some of the preventative measures? I mean, what should we all be doing to try to avoid this, and can it be avoided, I guess?
Sure. So there are two factors, like most of the medical diseases. One is genetics and the other one is environmental factors. So the genetics is if somebody has a history of aneurysms, they need to be checked out, and they should check out if their father, mother, brother, sister, or a close relative had a history of having an aortic aneurysm or aortic dissection or rupture or sudden death. I think they should seek evaluation.
Right, because sometimes you can have family history and not, Uncle so-and-so died, but
Right.
maybe that information didn't get passed along.
Absolutely, and so that's number one. Number two in the genetic part is if people with Marfan syndrome or some of the other congenital syndromes like Lewis-Dietz syndrome and a few other congenital problems have a higher incidence of developing aortic aneurysm, so they need to be checked and they need to be evaluated serially. On the environmental side, high blood pressure and smoking predisposes humans to developing aortic aneurysms, like many other medical problems. So we need to avoid smoking, and we need to check our blood pressure, maintain normal blood pressure.
Okay.
And I think these are the two important factors.
Okay, so lifestyle,
Right.
we're talking getting moving, eating healthy, avoid smoking,
Right.
and then just regular, sometimes we forget to just have our regular doctor visits.
That's right.
To make sure that everything's in order. So that's kind of your best advice going forward. Know your family history as well.
Absolutely.
Okay.
Absolutely.
All right. Dr. Zeeshan, thank you so much.
It's my
We really
pleasure.
appreciate your time. So this is again Cayman Heart Fund's 11th Annual International Symposium. You're watching Cayman Life TV. I'm Vanessa Hansen.